Hi everyone, good afternoon or maybe good morning, depending on where you live around the country. I'd just before we start, like to acknowledge the traditional custodians of the land we're on today, my land, your land, wherever you're from also, and thank them for their past and present and future leadership. So this afternoon is one of many webinars that we've been doing for talking about the nomination to our Indigenous Allied Health Board. For some people, you might know me. If you're a member, most people would know me, but my name is Nicole Turner. I'm a Kamilaroi woman. I'm current chairperson of Indigenous Allied Health and very proud to be in this position. I have some notes in front of me, so I apologise for looking down, looking up, but as it's Friday, the end of the week, my brain is a bit mushy. So I've just got notes here to remind me of what I need to say. So I've been in the position as a director for the last 5 years on the board, and the last 2 years I've been chairperson, which is a great privilege to be in that position. This is the last webinar for the nomination series. Through 2018, the board discussed, this year, the board discussed in one of our meetings, how do we encourage more people to nominate to be a director for IHA, and what can we do to help people feel confident enough to nominate for the board? So that's where the idea comes of having webinars. So we've had 3 so far, this is number 4. So if you haven't watched the others, have a look, and you can get that off our website or ask the Secretariat where they are. So the feedback's been really positive and people feel more confident now about having their questions answered and about also nominating for the board. So there's been different aspects discussed over the last 3 webinars around how do you nominate, what sort of responsibilities will you have, your roles, how much time you need. So some of the common questions about what is needed to be on this board. So I'm going to talk a bit about our board and also a bit about the organisation and as a board what we do. So we're a very high functioning organisation and we do above and beyond what we are required to do from our funding agreement, but our main focus is Aboriginal and Torres Strait Islander allied health workforce in Australia. So we've achieved so much in the last few years, which I'll mention a bit also as we go along, but you can also see in our annual report that's coming out soon and previous annual reports, or have a look on our website. Or if you come to any of our forums or our forum that's happening soon, you'll also see how much we've done and what else we're doing in the country. So we are functioning at a high level within a board, but we couldn't do this without having a very good CEO and very good secretariat that we work very well together. And that's also a good combination how governance works well, is having a very good functioning board and a functioning CEO and a functioning secretariat that all work very well together, which makes a very good functioning organisation. So as a board, we take our roles very seriously. We're in charge of a national organisation. So it's lots of roles and responsibilities that we take very seriously, and lots of high workloads also. Over the last few weeks, people have asked me and said, well, I'm not sure, I don't know much about what it sort of is to be on a board and governance and different things. So all boards are different, and all different levels of board. A community board, a state board and national board are very, very different. Governance is the same to a certain degree, but the levels are different. So at the start of each year, we do intensive governance training with all directors. It doesn't matter if you've already done that training before. Each year, at each start of year, we do it. We also do extensive financial training also. So all the board has to do that. That's a requirement to be there at that first board meeting to have this done, usually in February. And that is a requirement with our constitution and within our governance. So there's also opportunities throughout the year to further your skills in governance or different company directors courses that we have opportunities to go to, and also more financial training if needed. The auditor comes in also and talks to us about what is our auditing look like and all the aspects around that. So we cover everything, and we know, which we need to know also, every part of what's happening with our organisation. So that's critical. The role of the board is to govern IHA as an organisation, and as I said, it's a very serious role. The board has authority to determine matters relating to the direction, control, policies, practices and management of IHA. As a board, we formulate strategic plans, strategic directions, and we have the current strategic plan 2017-2020. That's ongoing at the moment. We have 4 main priorities in that plan. They are support, grow, transform and lead, and lots of other little branches come off each of those priorities, which has to do with what we do with our members. We have a vision, a purpose, shared values and principles also that you can see on our website. As we're in the second year of our strategic plan, we are optimistic about the opportunity to transform the health system. That's one of our main roles. We want to make the health system culturally responsive and make sure all our allied health, Aboriginal and Torres Strait Islander allied health professionals are in a very good, culturally safe health system. We welcome the National Aboriginal and Torres Strait Islander Health Plan and Implementation Plan, and envisions a health system free of racism, which is still happening a lot at the moment. There's a lot of racism out there in the health system, and we're working hard to eliminate that and especially help our Aboriginal and Torres Strait Islander allied health professionals through that system also. The strategic plan is owned by the IHA members, a committed collective of Aboriginal and Torres Strait Islander and non-Indigenous people in organisations who are our shared vision and believe in the essential role allied health plays in a holistic, culturally responsive health system. So you might hear me talking about culturally responsive health system, and that is one of our main goals in making the health system culturally responsive. So our direction for the next 3 years is in our strategic plan, which you can have a look at on the website. And if you're thinking about nominating for the board, it's a good idea to have a look at that. And it's not long, it's not very long at all, it's short, but all our main priorities in there and what we want to achieve and what we want to get to in the next 3 years. As a leading national organisation, we provide professional development opportunities and support for our members. We do this through our mentoring program. If you're not sure about that, have a look on the website. We do a very good mentoring program also. And we do lots of scholarship opportunities that some of you might have already been aware of or already had that opportunity to get a scholarship through IHA. We strengthen leadership capacity across the allied health and Indigenous health sectors. And so the way we do capacity building also is through our board and through our Student Representative Council. And if you don't know about that, have a look again on our website and see who they are. But we do a lot of capacity building around our board and around our student council and for our members also. We work closely with key education stakeholders to support educational pathways into allied health and improve health curricula. We do this with many universities. Our CEO has a very good relationship with lots of universities, and looking at the current curriculum and how it needs to have more about culturally safe and culturally responsiveness health systems in there. And also the other thing that we're very proud of this year, we developed our first Northern Territory Health Academy. And I can tell you more about that another time. But that's something very proud. So we're looking at pathways for young Aboriginal and Torres Strait Islander students in Northern Territory at the moment. And there's lots of interest around going other places around the state. But we've started this. We have 16 full-time students that come in 1 day a week and to our health academy. So that's something else we're very proud of, looking at pathways into a university, allied health university degree once they finish a certificate in allied health assistant. So we work in partnership with key stakeholders also, and we have a lot of key stakeholders around the country. We provide expert advice to governments and stakeholders on Indigenous allied health workforce and Indigenous health policies. Our CEO and myself meet with various ministers around the country on a regular basis to discuss Aboriginal health workforce issues and other issues around Aboriginal health and Aboriginal affairs. So we have a really good relationship with government, current government at the moment, and all governments at the moment, and that helps a lot when we're forming good relationships and looking at programs, and especially something like our Health Academy. So the other thing is we work closely with health sector partners and communities to improve access to culturally safe and responsive allied health services. So we've been doing a fair bit around our culturally responsive framework that we've developed, which has been really critical to us and critical to the success of transforming the health system. And if you haven't heard much about our cultural responsiveness framework and our cultural responsiveness workshops, have a look at that. And if you haven't already been to one, I really, think that you should go to one and see what we do. We've been doing a lot around the country, especially with non-Indigenous allied health professionals, and the feedback's been incredible. So yeah, so something that we've done by request, that it's not cultural awareness, it's more than that, it's giving people the tools on how you actually be culturally responsive. So that come from requests from non-Indigenous and Indigenous organisations looking for more about how people can engage and do different things with Aboriginal and Torres Strait Islander people. That's been a very big success. As a national Aboriginal and Torres Strait Islander organisation, a peak body, we have a leadership statement also that is on our website that you can have a look at, and that is what we believe in, and that is what our organisation's about. But it's about also, we're committed to leading in the allied health sector and working closely with Aboriginal and Torres Strait Islander peoples and communities. We view our leadership roles through a unique and diverse lens that support Aboriginal and Torres Strait Islander peoples, culture and knowledges that are essential to achieving our vision. So we've got a vision also, but this is what we believe in, and it's different because it's looking through the Aboriginal and Torres Strait Islander lens. So there's lots of other leadership statements out there by mainstream, but this is looking through a different lens, and we have to remember that by looking through a different lens, it is different. We work closely with each other and our communities to assert Indigenous rights and have ownership over Aboriginal and Torres Strait Islander people's health and wellbeing, and improve access to allied health service. That's something else we do. We're looking at how access can be improved, and looking at also, we talk about the A's, and as a board, it's really important with the strategic plan, looking at not just access, but availability, affordability, appropriate cultural safety in organisations too. So we're very serious, and we take all this very serious also as an organisation. So you can see, as a national organisation, we do a lot around the country, and we will continue to do so. So being on IHAR board is really important to have that national vision and that strategic direction about how we drive our organisation into the future, and how we can change at a national level and have input at a national level. In the last few years, IHAR has grown as an organisation, not only in members, but also in staff. So we have a big workload, and we are still only a small organisation, but our staff work very hard to get everything to what we want as a board, and work on that strategic plan to go where we want to go. So, and this has been noticed by government as our funding was renewed for another 3 years, which is great. We had a small increase in funds, which is always good also. So we are noticed by government, and we have a good relationship with government and ministers, and this is important to our success also. Donna Murray, our CEO, has regular meetings with ministers in Canberra, and also in other states around the country. And that's another thing why we want people from other states. Our directors are from all different areas, and they're from all different disciplines also. So as a collective, we come together from all different states and territories and different disciplines. We have 5 or 6 different disciplines on our board, which can be challenging at times, but we all come together for the strategic plan and for the strategic direction of our organisation. And that's what it's about. It's about coming in, that's the hat you put on when you come into the boardroom. You are IHAR, and you're there for IHAR, and that's what we do. And as I said before, we're very high functioning and very proud of what we've done so far in the last few years. And as I said, it's really important that we do show very good leadership to our government, and for our members, importantly for our members, because our members are the ones that are in control of our organisation. So they vote us in and we are there for the members, and our credibility is very high with around the country. So around the country, most people know who IHA is now, and it's really great to go places and be recognised for all the hard work that we all do around the country. So, and also we're involved in a lot of national campaigns and national organisations, other organisations, and we're also involved in the National Health Leaders Forum, which our CEO sits on, and IHA is involved in that, and that's the National Aboriginal and Torres Strait Islander health leaders from the country sit on that forum. So and that goes to government and ministers' feedback about what's said in that and in that forum, and the other thing is government and ministers send to that forum about interesting things they want to know about also. And the other thing is that we're in part of the Closing the Gap steering committee also, and around the whole refresh also of Closing the Gap and other important national campaigns and national reports that are happening at the moment. So the rewards of being a director on a board like IHA are endless. If you're willing to put in the work, you'll really enjoy being part of a national organisation. As I said, there is responsibilities, and the other 3 webinars talked about the roles and responsibilities, how much time. So you do need to put a bit of time to it, and you know there is 4 meetings a year that you need to commit to, and a lot of before the meetings there's a fair bit of reading that you have to go through the board papers and know exactly what it is. But if you're willing to be involved and be motivated and confident about doing this, I really think you should apply, because you'd be great on there. And as we know, you know, you're all leaders in this space, and you've done the hard work to get your degree, and there's lots of obstacles and challenges through that to get to where you are now. So it's great for you to think about nominating. And you know, if you want to call me or have a talk to me or anyone else at the Secretariat about any queries you have, or the Secretariat can give you my email details about queries you have. I'm happy to have a chat about that. But as I say, you know, be confident, have a go, and what's the worst can happen? You might put your hand up to be elected, and you mightn't get elected, and you do it again next year. So, I mean, it's a great experience to even go through that process, to have a go. But it's also about looking at strategic business and being on a national organisation. I have learnt so much, being a director, and then learnt so much more being the chairperson. And it's great. I pretty much know now at a top level everything that's going on in the country around Aboriginal health, and that's the other thing. I work at a community level, but then I could be working at a community level one day and then be down Canberra one day in Parliament talking about national issues. So that's how exciting it is, I suppose, and it's really exciting, and it does give you lots of confidence knowing that you're part of a Indigenous national Indigenous organisation. And the other thing is that changing the future for our people, we have to put our hand up and be confident to have a go and get up there to the top and change. That's the only way we're going to change the future, is be leaders. I mean, you can change your future, be leaders everywhere, but at a national organisation, you have quite a good voice at the top, and be able to talk to ministers and have the opportunity to talk to people about changes, policies, and what needs to be done in this country for our Aboriginal and Torres Strait Islander people. So the other thing, if you want more information about applying for the board, you can get on our website or call the Secretariat, IHA head office in Canberra. And the other thing is that I hope to see you all at our forum that's at the end of the month, and make sure you make yourself known to me if I haven't already met you. And you've got till Monday afternoon to nominate for the board. So it's all on our website. As again, if you're not sure, let someone know. But I look forward to looking at all your nominations, and don't be scared. Put your hand up, because it's the only way we can make a difference in this country, by putting your hand up and saying, I'm happy to apply for this wonderful, wonderful board. Thank you very much. Bye.